I wasn't getting out of bed.
I wasn't going to work.
I hid my problems from everyone.
I didn't want people to judge me.
I watched my daughter suffering.
I didn't know what to do.
Because you joined the conversation, we know we are not alone.
We are not weak.
We are not ashamed.
We are strong.
And help is out there. We need to ask for it. Join the conversation. Visit letstalkstigma.org.
Hello, I'm Carl Shallahorn, Chair of the Erie County Anti-Stigma Coalition. I'd like to welcome you to the fourth in our Facebook Live series. The Erie County Anti-Stigma Coalition is a group of people and organizations that have been working together to end the stigma related to mental illness through our Join the Conversation campaign. These Facebook Live events have been a way to have people join the conversation on mental health and mental illness. Today, we're focusing on the effect of stigma on people serving in the military. Since the founding of our nation, the U.S. military has sacrificed so much to protect our freedoms, but it's come with a cost. Over the years, many active duty service members and veterans have had to endure the mental and emotional anguish that is associated with the stigma associated with their call to duty, whether it be on the war front or at home. So today we're going to be exploring this topic with 4 local professionals. Now, before I introduce our panelists, here are a couple of housekeeping rules. Our program is for 1 hour, and during the course of this time, if you have a question or comment, please type into the text box and we'll respond accordingly. Today I'm joined by our 4 panelists who will each provide their own perspective on this topic. First, let me introduce Chris Kreiger. Chris was inspired to co-found WNYHeroes, a veterans assistance organization, as a result of personal experience gained following a decade of service with the United States military. He joined the U.S. Army in 1997 with primary military occupational status, otherwise known as MOS, as a combat medic, and secondary MOS as military police. The organizational goals, as well as Chris's, is to ease the transition from combat to civilian life and eliminate the hardships and complications that too many veterans continue to experience in America today. Next, we have Katie Coric, LCSW. Katie has worked as a social worker in the West New York community for about 15 years. Her current position is the VA West New York healthcare system as a suicide prevention coordinator and emergency services program manager. Katie has over 15 years of experience working in settings with adolescents and adults, providing trauma-informed treatments to individuals who struggle with self-destructive behaviors and struggle with managing mental health symptoms. Next is Dr. Patrick Welch. Dr. Welch started his military career at 17 when he enlisted in the United States Marine Corps. While serving as an infantry squad leader in Vietnam, he was severely wounded in action and was hospitalized for 2 years, recovering from his wounds. Dr. Welch was an international hospitality industry executive for 48 years, has worked in over 50 countries, has been a chief financial officer, chief operating officer, chief executive officer, and owner of several businesses. He served as director of veteran services for Erie County, New York, and as an adjunct professor at Damon College. In January 2008, Dr. Welch became involved in the Buffalo Veterans Treatment Court as one of the first veteran mentors in the country. In 2010, he founded the Center for Veterans and the Veterans Family Services at Damon College in Amherst, New York. And now retired, he concentrates his efforts working with veterans involved in the criminal justice system with the Buffalo Veterans Treatment Court and Justice for Veterans. And finally, we're joined by Cathleen Larsen. Cathleen is a contract coordinator with the Erie County Department of Mental Health, where she has worked for the past 5 years, collaborating with agencies that provide mental health, housing, mentoring, and court-related service to veterans in the community. She's also an active member of the Community Veterans Engagement Board, working to improve access to services, healthcare, education, and employment opportunities for veterans and military families. Cathleen is a licensed master social worker who has worked in the human services field for the past 20 years, previously providing both mental health counseling and service coordination services. So welcome, everyone.
Thank you.
Thank you.
Thank you.
So I'm going to start off by asking this question of Dr. Welch, Katie, and Chris. When you hear mental illness in veterans, I think most of us immediately think of PTSD. We all hear about that term, post-traumatic stress disorder, especially for those who are combat vets. But the reality is, I'm sure it goes much beyond that place. What would you say are the 3 key mental health issues for veterans today? More specifically, as relates to those who are combat-related, non-combat-related, and even families. So let's start with you, Dr. Welch. What would you say would be your response to the 3 key mental health issues that affect veterans today?
Well, first of all, I want to welcome everyone to this program, and hello to my fellow panelists. Let me start off by saying I have PTSD. I have had multiple instances in my life, both in the civilian and military world, and I have still led a very productive, meaningful life. So PTSD does not mean that you can't function in society and have a healthy, well-balanced life. I think the 3 main things that I would touch on is the title of why we're here, stigma, and all the things associated with it. In the military, it's a sign of weakness. If you are someone who comes forward and says, I need some mental health help, first thing that happens is command becomes weary of your ability to function. Your fellow service members begin to doubt your ability to perform. And when it's in life and death situations, we all need to know that that person on our left or right is going to be there for us. And I think also it can be career ending. The Department of Defense will come out and emphatically deny that there is any relationship to the end of a person's career and their mental health well-being. But I know Chris will back me up, and many other veterans in this country will say that that's a lot of BS. If you have mental health counseling in your personal record file and promotions come up, you're going to be looked upon as less likely to be promoted than a person that does not have any mental health records. In the area non-combat related, I think one of the things that we have to continuously stress, and I think it's important for us who have been combat veterans, is to make the civilian world understand that it's not just the military. Anyone is subject to trauma. And any instance of trauma can be the condition that's created for PTSD. The major difference between the military and civilian world is in the civilian world, normally it's a one-off experience. In the military world, in a combat environment, it can be an everyday occurrence. And then in the area of the families, we're going to talk about it a little bit later, but I view secondary PTSD in military families as a huge issue that I do not believe has gotten enough coverage and enough work has been done on.
Chris, how about you? What are your thoughts?
I think Patrick basically put it all, summed it all up right there. But I'm a firm believer, and yes, Patrick, as you know, I back you 100% on your statements. And so many people use, PTSD. And I believe Patrick, you'll back me on this one too. Really, I don't like the D part. Post-traumatic stress disorder. I think that's part of what adds that stigma to there's something wrong with you, instead of just calling it that post-traumatic stress. And again, going back to what Patrick had made mention of, is post-traumatic stress. Yes, it can be, anybody can get it. You can get it from having a car accident. You can get it from being on a bicycle and being hit by a car, as we were discussing prior to the show. You don't have to be a veteran to have PTSD, but when I believe when people look at PTSD, they automatically assume and go directly to the word veteran. And that's where a lot of veterans, again, who are afraid to come forward and say, I need the help, because you already have veteran that people look at completely different from civilians. Then they put on there that, the title of PTSD, and then they get the title of crazy or wacko. I've heard them all. And going back to what Pat had touched on too, is that if you are in some sort of civilian employment position, i.e. police officer, and you go for help and you want the help, you're then immediately punished for seeking that help. So I think a lot of people, they withdraw from seeking that help, even if it's a civilian. Doesn't have to be military. Civilian or military, they're going to withdraw from that because they don't want that stigma. They don't want to be punished for seeking the help. If you look back to where you made mention with the families, same thing. Our families are dealing with a level of PTSD that they never asked for, especially the children. You're placing a severe amount of weight on their shoulders that they're forced to carry through your whole military career, and then even after that, because the way they're going to be raised, the way they're going to be treated is going to be completely different from the individual normal dad or husband who never served. So the family, and you're right, Patrick, 100%. I don't think the families get enough recognition or enough help out there for what they too have to deal with. Because let's face it, today, especially to serve our country, it takes the family as a whole.
And Katie, of course, your work at the VA, you have responsibility yourself. And so what would you say?
I mean, I can sort of echo what Patrick and Chris have already said too, as far as post-traumatic stress being a kind of normal reaction to a pretty stressful situation, right? So here at the VA, we may be seeing veterans who've experienced all types of trauma, and some of that might be combat trauma. Some of that might be, years after their service where they're having a hard time and maybe going through a relationship that's ending, or experienced, a car accident or other grief and loss issues. The other thing I wanted to touch on was something that we're viewing more recently as part of a risk factor, something called moral injury. Many people who've served have been put in situations where, their worldview is changing and they aren't quite sure how to rectify in their heads the service that they're doing and, the sacrifice that they're making. And we're seeing, some veterans having a harder time transitioning back to civilian life. That's what I wanted to touch on too, was, just the transition difficulty from the military. Sometimes leaving the military means a loss of purpose for people, and they have to go through kind of a period of exploration to kind of find their next purpose, their next mission in life. And, those are some of the things that we're treating here at the VA too.
That's good to hear. I'm glad that you're addressing that concern. Now we know, of course, we have Dr. Welch. You served in Vietnam. Chris, you served, in the Middle East. Generational differences. We know there are generational differences. Based on when you served, are there any differences or any issues that might manifest differently, or are we talking about the same concerns, would you say? What would you say, Chris? I think you're muted, Chris.
Okay, there we go. I've always, the host has me muted.
Oh, I'm sorry.
Oh, okay. I think when you look at the generational part of it, I'm a firm believer in it doesn't really matter where you served, combat or not. We all wore the same uniform. We all cry the same tears, bleed the same color. War is war. So it doesn't really matter whose ground it's on. Yes, I think times have changed when you look at the military, from injuries to now, and the amount of soldiers, veterans, Marines who, their lives have been saved as opposed to back then. The trauma, I still firmly believe, is going to be the same. Vietnam, they dealt with a lot of casualties and Agent Orange. Iraq, Afghanistan was dealing with IEDs and more loss of limb. Then you got the Gulf War. They're dealing with Gulf War syndrome. So I think your injuries are different according to the generation. But at the end, when you look at it, everyone's still dealing with that end product of the PTSD.
And how about you, Dr. Welch? What are your thoughts?
Well, let me start by saying no one absolutely no one goes to war and ever returns the same person. To the best of our knowledge, the first indications of mental health problems in warriors goes back to Homer in his writings in the Iliad, talking about the Roman soldiers coming home from campaigns, and he used the word they were different. Warfare is warfare, as Chris has said. And I think when you look at it generationally, about the only thing that's different in warfare from the Roman times to today is the methods that we use to kill and maim each other. Mental health issues are with everyone who has gone to combat, even with people that have gone through boot camp. Boot camp can be a life-altering experience for many people. So I think generationally, yes, I was in the jungle and the rice paddies. The current generation is in the sandbox and in the mountains. But there's 18 million veterans in this country right now, and that means that there's about 18 million different stories. Everybody experiences war in a different way. And so that is the issue in treating people that have mental health, is one's own experiences versus mass experience. So I think, that's about, I think, what you might look at as generational differences.
Okay, thank you. Thank you so much for those insights. If you're just tuning in, we're joined here. I'm Carl Shallahorn from the Erie County Anti-Stigma Coalition, here with Chris Kreiger from WNYHeroes, Katie Coric, Suicide Prevention Coordinator and Emergency Services Program Manager for the VA West York Healthcare System, Dr. Patrick Welch, Veterans Advocate and Senior Mentor with the Buffalo Veterans Treatment Court, and Board Chair for the Community Veterans Engagement Board. And lastly, Kathleen Larsen, Contract Coordinator with the Erie County Department of Mental Health. So let's continue with some questions. Now, I know we discussed this a little bit already, and of course, Dr. Welch, you certainly made some very essential points about how those in the military are viewed who may have mental health concerns or challenges. What about getting help through, say, the VA? Now, I know now, of course, Katie, you work for the VA, and this is certainly something that you do every day. Katie, what does the VA do specifically for our veterans?
Quite a bit. I mean, the VA has like a pretty comprehensive system of care here. And one of my first jobs here, I worked on our inpatient psychiatric unit. And so I got to hear firsthand from so many veterans who were, very deeply in crisis at that point in time about their fears and stigma about related to them reaching out for help while they were in the military. And those were, very real fears, as Dr. Welch had already attested to. And I also, this is in the past 10 years, also got to see times where active duty military who were in crisis and really needed some emergent mental health support, were here in the hospital with us, and their commanding officers were very supportive of what their needs were. I don't know that they always understood them, but they were very supportive of those, military personnel, and very much, sitting in my office every day asking, what's this person going through? How can we help? How can we help their family? And very much involved. And so I don't know if that means the military is changing in that regard. I certainly hope it is. Anytime we put up these barriers, it just leads to individuals waiting longer to get help than they should, which can mean they're coming in crisis versus coming in when they're noticing some symptoms initially. So, here at the VA, we have a full service emergency room for anyone who needs immediate assistance. The VA has a national veterans crisis line where anyone can call, text, or chat at any time of the day or night, and family members can reach out too if they need support or if they're concerned about a veteran. And some people feel a little nervous about reaching out to a national call center. I think the beautiful thing about the Veterans Crisis Line is that, if a veteran called the crisis line right now, they would be, they'd be able to help that veteran in the moment and put through a referral to our local suicide prevention team, which means that someone locally would then be able to reach out to that veteran, assess how they're doing, assess what their needs are, and see what ways in which we could be helpful, whether that's through the VA or WNYHeroes or a Veterans One-Stop Center, wherever the veteran's willing to get treatment. So We have a full, system of outpatient mental health care, outpatient substance use treatment. And I guess what I'll say is that, I'm hoping that there's really no wrong door, that any point in our system that the veteran comes in, we can make sure that they are connected with what they need and want.
Well, and that's a great point. I'm glad you said that because what we're really talking about is a network. And we know that, in the mental health system in general, it's a matter of knowing where to go and where to get your answers. And of course, the Veterans One Stop Center is certainly a great resource in our community, but also Kathleen, in the work that you do through the Community Veterans Engagement Board and the work with the county, you assist some of these organizations and agencies to make sure that the resources are available and that people know where to go to get help. So what's your perspective?
Sure. Coming somewhat from a community aspect, with working with a lot of our community partners, the Department of Mental Health really, values the veterans and knows, the stigma that has added, an extra level, layer onto it. Accessing mental health services, there's a stigma in general, and then we know, adding the layer that the veterans, experience adds to that. The department definitely, supports a lot of our community providers in setting up services for veterans. We actually work very closely with Veteran One Stop Center, and they have a wide variety, of services available. They have, services, for, educational and employment services, financial counseling. They have, their peer program is probably one of the ones, I'd like to, discuss. We know how important it is for, veterans to talk to someone who's been going through something similar or who has been in a similar position. And Veteran One Stop Center has, their Dwyer program, which is linking veterans with peers. They have social activities, they do, group activities, and it really is very important because those veterans are able to link with someone who has gone through something similar. A similar experience that they can talk to. Just in terms of some more community services, we work with a lot of our community mental health agencies, where veterans and their families can go for counseling. A lot of them, Spectrum, Human Services, Endeavor, Health Services. Those are places in the community that veterans can go and their families. They do counseling, individual counseling, family counseling. So we really do, work with our community partners to really provide access to all those services.
So we do have a question that just came in. Can you be discharged from the military if you have bipolar or PTSD? And I know that is something that you kind of addressed, Dr. Welch, in your initial comments about how, not only the stigma, but if it's reported or if it's diagnosed. So what is your response to that?
Well, I think two things. First of all, bipolar, I think, has become more and more of an issue as the years gone by, as we enhance our abilities in mental health care to identify people with some issues. From a standpoint of discharge, it can be cause for discharge, a diagnosis of bipolar. So I think that's something to look at. I know Chris is involved in that. I may let him touch on that a little bit more, and also with Katie, but it can be cause for discharge.
So Katie, do you have any other thing to add to that?
I think probably Chris could speak better to the military portion, but from where I sit, it almost seems like anything that could negatively impact your day-to-day life could be cause for like a medical discharge from the military. So anything from, a significant physical injury to a significant, mental health symptoms that are affecting your day-to-day life, could be cause, for a medical discharge from the military.
Chris?
Yeah, I agree, obviously, with Katie and Patrick, and really from our experience, and Kathleen and Katie, if you guys can correct me if I'm wrong, PTSD, TBI, and bipolar all have pretty much the same similarities. So it's my understanding that it's, at least in the beginning, it's kind of hard to differentiate, what's going on and which one of those three, if not all three, that you are suffering from.
Well, if I can add in my little 2 cents from my background, absolutely. When we talk about the onset of a mental health condition, it may be hard to determine what it is. And so actually, let me ask this question. And I'm going to draw. Let me say a little personal. I have a calendar over here, and there's a picture of my late father-in-law, Dr. Peter Regan, who served in World War II. He was a psychiatrist who actually worked for the VA. He was an administrator at the VA in Washington. And I think about, some of the stories he would talk about with the people he worked with. And of course, at the time they talk about shell shock. And of course, there's been different, terms over the years. But initially, when a person presents with a problem, you don't always know what it is. But there's assessments that are done. So maybe Chris or Dr. Welch, when it comes to treatment, or at least acknowledging the problem, what are the steps that a person would go through to make that determination?
Well, I think the first thing that always has to happen in any situation, whether it's alcohol or substance abuse, that person has to acknowledge that they have an issue and that they need to seek treatment. My personal experience, it took me 20 years after I left Vietnam before I finally agreed that I needed some help. So I think that's the first step in it. The second step is that in the assessment process, which has gotten much better over the years, again, as we've refined our practices and our knowledges of this issue, the assessment has gotten much better. Symptomatically, those three things can all present as the same condition at first in the assessment process. And in some cases, it's led to the misdiagnosis of a person's issues. In some cases, a person with PTSD has been diagnosed with TBI and vice versa. And the treatments for those differ. So the assessment has to continue to get better in the treatment. And then the third part of it is that that person has to agree to enter a treatment protocol. We see it quite often in the Veterans Treatment Court that people are presenting with substance issues or mental health issues. They fight the reason for going into treatment. The reason we call it a treatment court is because it is just that. And therefore, that person has to give in to a program of treatment for any chance of getting better.
Thank you. And of course, the treatment court was the first of its kind, right? I believe in the country,
yes,
to serve veterans, and has actually been instrumental in changing lives. It's amazing how that kind of intervention can really help someone that perhaps may not have been able to access services any other way.
Yes.
Yeah. So we had another actually comment come in. So what can be done to make sure that across the VA, providers can make sure that non-mental health providers, like say primary care providers, know about programs like Batavia Inpatient Treatment Centers and the PRRC in Buffalo?
I could touch on that. The VA is a very big system, right? So here in Buffalo, it's a hospital system, it's a nursing home system, it's outpatient mental health and primary care system. And so I think for many things in our professional and personal lives, there's this constant education that has to happen. So, medical providers may have to constantly educate me as a mental health provider about some resources that we have, on the medical side of the house. And also our mental health team has to sort of constantly re-educate the medical side of the house to know about what's available for veterans with, mental health struggles. I will say that sometimes this is where specialties can really be helpful. So in each primary care unit here at the VA, there is a mental health professional that's housed right with that primary care team. And so, many providers will ask the primary care social worker or psychologist to meet with that veteran same day. We can do that now, some in person and also virtually to talk about specific programs that we can, talk with veterans about.
That's great. And so we know that, and it keeps going back to the idea of just really knowing where these resources are. So Kathleen, I know once again, you talked a little bit about what is being done by the county. Are there other ways that the county is able to help individuals? I know you work with agencies, but what other kinds of outreach do you do?
I was thinking, as Katie was talking in regards to, the same, is true even in community between community partners, not even, just in the VA between different departments. But when you think of, individuals that might be receiving, their medical health, but also, behavioral health treatment and that, communication in regards to, different programs out there. Myself, and I know others, on this as well, are part of the Community Veterans Engagement Board. And I think that group is great because it brings together a lot of providers, VA providers, community, partners, behavioral health agencies, medical, a lot of different providers so that we can all collaborate together. We're learning about other programs, ways to, outreach and, get those programs and information, out to the community. So, I think that's a great collaboration that we've been part of, really to make, the community aware, veterans and their families of different services, that are, available, and then also to, providers. Working with medical providers on, assessments and including that information, for veterans. So working with the community to make that collaboration happen as well.
Excellent. And once again, if you're just joining us and you're tuning in, you can always submit your questions to the chat box and we'll try to address them. We're getting a lot coming in. So bear in mind, we'll try to get as many as possible. So if you don't hear your question coming through and you really, really, really want to get the answer, feel free to put it in again. I do want to just throw it out there. Sometimes the confusion within the VA, what can you do to make sure that care providers know what VA programs are available within the VA? And of course, Katie, once again, this might be more directed to you, but really, I think we're talking about understanding, like, is there a point person or department or is it you, or who would really coordinate that at the VA?
So as part of suicide prevention, we do a lot of outreach into the community where we can, share specifically about VA services that are happening. Here we do, in-services and staff meetings regarding, different mental health screenings that we're doing, also regarding, programs within our behavioral health department. So at the VA, we do have a behavioral health director. So she would be a good point person. I would be a good point person. I'm happy to talk to, any veterans or family members or, community members about what resources are available here at the VA. And I do think it's sort of just like a constant re-education as new staff come on board of what we have available to help, veterans in a holistic way.
Excellent. And Chris, so we know with your work with Western New York Heroes, your a lot of your job, so to speak, is that preparation of transition back into civilian life. What about the resources that you provide specifically with your organization, and how do you help our veterans?
So our main focus or mission of Western New York Heroes is the financial support. Me personally, coming home and losing everything, our home and our family falling apart, I didn't want that to continue happening. So in the beginning, it was a one-time payment where we can pay your mortgage, your rent, your utilities for you. And it's grown into now we can help you with 4 months of back rent, security, deposits, and utilities, and food on the table. Off of that, then when we look at the mental health side of it, we have our Positive for Heroes service dog program, where the veterans that are coming into the program have all been referred to us through the VA hospital, through treatment court. We've had veterans come to us. They've been referred to us through the vet center. So when we look at the main focus, which we see veterans need help with immediately off the bat, it's always that financial piece. And then many of them come to us for that mental health side of it. And we tell everybody, just because you receive a service dog, that's not the cure. Like, we're not telling you, here's your service dog, your problems are over, you're fixed, go live a fabulous life, right? I believe, I'm not sure if it was Katie or Patrick who touched on it earlier, that this is just part of your treatment plan. We encourage you still take your medications. We encourage that you still go to, your your counseling sessions, your therapy sessions, and still see your medical providers. This is just part of that treatment plan. So the service dogs are there, yes, and they will always be there for you. But this, again, it's all part of your treatment plan. So with that, we have the other programs. We do get referrals from Veterans One Stop. We get referrals for many other programs that we offer. In my opinion, it's a collaborative effort. If we come together and, we all have the same focus at the end of the day, who cares if you have 4 organizations or 4 individuals helping one veteran? Is at the end of the day, is that individual who needs that help or getting the help?
And of course, the byproduct is the families. Many times these veterans have families as well. And then, so speaking of families, I do want to make mention, Carol Doggett, who works the Mental Health Advocates of West New York, mentioned Operation Calm, which is Operation Children of the Military, which is, I must say, it's a phenomenal program for kids who have parents who are military members, and they do incredible work. So we don't want to mention that as a resource. But speaking of the families, so we know that the spouses, the children, even the parents of military members, they also may experience a trauma. We touched on that before. Also, the stressors associated with their loved one's service. What might be some of the issues they're dealing with specifically, and what services are available to them? So let's maybe start with Dr. Welch.
All right. Well, thank you for bringing it up. As I mentioned before, secondary PTSD in families is well known, and it has not been given the attention, in my opinion, that it deserves. And I think there's a couple different ways of trying to get people to understand it. First of all, the active duty military are serving on a base, and they may be at Fort Bragg, and the population may be 35,000 people. Well, the active duty community has family readiness groups. The kids go to school together. The spouses mingle together. So there is a community of support with the active duty military. From a standpoint of that aspect of it, multiple deployments has not been helpful for the family unit. You've got some service members that have done 10, 12 deployments, and they're never home. And even when they are home, they're ramping up for the next deployment. So the person who's left at home to care for the family winds up being both parents, providing a set of rules that are governing the family while they're home. And then when the spouse returns, all of a sudden there's another dynamic where the spouse wants to re-inject themselves into the family's life, and it creates confusion with the children as to what rules they're following. In the Guard and Reserve, I think it's been more prevalent. If you look at the Buffalo area, we've got around 9,000 Reserve and Guard people in our community. Before the Iraq-Afghan war, Reserve and Guard people were 1 weekend a month and 2 weeks in the summer. That no longer exists in that community. At the height of the Iraq-Afghan war, 142,000 troops were deployed, and like 60% of those troops in Iraq and Afghanistan were Guard and Reserve personnel. So now you take a family unit where the children are accustomed to seeing mom and dad every day, and tomorrow mom leaves. Now mom's going to be gone for who knows how long. Dad is now home taking care of the family, and dad implements a set of rules that he wants the family to live by. The children are in classrooms, and what do you think most of their thoughts revolve around? Am I ever going to see mom again? So it starts to affect their academics because they can't concentrate, they don't learn well. It starts to affect their social life because they know that Friday night there may be a dance at school, but Friday night is the night I'm getting a satellite phone call from mom in Afghanistan. So their social life starts to deteriorate. So one of the things that we did during the height of the war, I began a program with some of the schools where I was lecturing to the school psychologists about secondary PTSD issues. and try to get them to understand if all of a sudden you have a child that is not performing as they have in the past, the response is not to give them a detention to try and get them back in line. The process should be to ask, do you have a loved one in the military? And when that child says, yes, mom's on her 3rd deployment, that you get them some help. You don't punish the children.
That's a very sensitive and empathetic approach that I think is very very much needed. You're absolutely right, Dr. Welch. That's a great suggestion. Katie, I have a question for you that has come through, and I want you to verify this because we want to make sure that the questions that we're asking and the answers are appropriate. This individual says that the VA does not offer EMDR. Is that correct?
We do have a few providers that are trained and qualified in EMDR.
Thank you for clarifying that. That's why I wanted to answer it that way.
Yeah, I'm glad you did. And so there is a few providers, within our mental health clinic and some of our other, smaller mental health clinics that are trained, and licensed in EMDR. And probably that speaks, some to the confusion about, what resources are available in the community, what resources are available at the VA. But if there are particular treatments that the VA does not offer, for whatever reason, if a veteran was found to be in need of those treatments, there is some process that we can go through that was started with the Mission Act to be able to offer care in the community with, community providers that is paid for by the VA as long as we don't offer it and, the veteran is in need of that sort of treatment. So certainly, we probably don't offer every single treatment at any given point in time, but there are ways for individuals to get treatment in the community through their VA eligibility.
Thank you. And just so for a point of clarification, again, EMDR is eye movement desensitization processing, which is a trauma therapy, which is more recent in terms of its utilization rather in therapy, but it's proven to be very effective to address trauma. So that's what EMDR is.
Absolutely. Yeah, great.
Just want to remind people that we're joined by Chris Kreiger from WNYHeroes, Katie Coric, Suicide Prevention Coordinator and Emergency Services Program Manager for the VA West New York Healthcare System, Dr. Patrick Welch, Veterans Advocate and Senior Mentor with the Buffalo Veterans Treatment Court, and Board Chair for the Community Veterans Engagement Board, and lastly, Kathleen Larsen, Contract Coordinator with the Erie County Department of Mental Health. I do have one question for you, Kathleen. So we know that there are some successful programs, and we've heard of many of them already. Of course, we know West York Heroes, the Veterans One Stop, and Operation Calm. Are there any others, maybe not have been locally, but nationally, that people might want to tap into that they may not be aware of?
Sure. When I think of, some of our, national programs, and we're lucky enough to have some of them, locally too, the Dwyer Project is a national program that provides support to our veterans. And locally, it's Veteran One Stop Center, that is a provider of, that particular program. But that encompasses a lot of their programs. Like you had already mentioned, Operation Children of the Military, is a great collaboration for, children of military, members. But also families, they have a family and caregiver program as well. And I think the nice part, about all of those is it's individuals who are going through similar, situations, similar, circumstances. Their, Dwyer program is nice, all three of them, the program for their families, the program for the children, for the veterans is nice because it's not a clinical program. It's, it's maybe a good way to start for some of our, family members, some of our service members, veterans, a nice way to, start accessing services because it's not a clinical setting, and a way to get support, and talk about, some of the struggles they may be having.
Thank you. And so we do have about 15 minutes or so left in our conversation. If you do have a question, feel free to send it in through the chat feature, and we'll try to address it. And so another question that came through, could you offer any suggestions? This also is about family members. However, it says, could you offer any suggestions to family members who have a veteran in their family that may be isolated from others, that still harbors a lot of stigma to even seeking out therapy, even on an outpatient setting. So in other words, the veteran is reluctant to seek help because of the stigma. What can be done to help families encourage that individual to get the help they need? Maybe let's go with Dr. Welch. What do you think about that?
Well, it's a very difficult issue. Again, I'll go back to the fact that someone needs to understand themselves that they do need some help. We've encountered many situations with veterans just in that case, and there's several different reasons for it. I'll just give you a couple. First of all, the experience in the service. If it was not a great experience, that will sometimes turn people off for seeking help from the VA. If they had a good experience, then they may be more likely to seek help. I think from a standpoint of Vietnam veterans, a lot of my fellow vets went to the VA once, and their treatment was so poor and they were treated so badly, they decided not to ever go back. So we have been spending the last 50 years trying to get our fellow veterans to understand that it's the good VA now. They've made a tremendous amount of progress. And so we are constantly out there searching for those veterans and encouraging those veterans to give the VA another opportunity. The COVID time period was a good example for us to help get some veterans back into the VA system, because I was being contacted, as were many other veterans, saying, I need to get a COVID shot. And we said, well, we'll go to the VA. And they'd say, I'm not registered in the VA. And we'd say, let's go to the VA and get you registered and get your shot. So while it's been a very, very traumatic time period over the last year or so, from a veteran's standpoint in getting to the VA, it has helped some.
Thank you. And Katie, do you have anything to add to that?
Yeah, I think that Patrick was sort of alluding to this, but I think it's a really important question. I'm glad that someone asked it. But often if I'm hearing from family members saying, my loved one who is a veteran, I think they need some help. I think even they think they need some help, but there's a lot of barriers to coming in, right? It's really hard to say, hey, I'm struggling here. I have to make some changes. I think it's hard for all of us. But sometimes what I'll do if the veteran's willing to talk with someone is I will send a peer out. So I'll send another veteran who, they can just talk and engage with them and swap stories even, and, share information about, what resources are good in the community. What have they used themselves that they feel is helpful? Could they go with them, to a counseling appointment, even just to get them in the door? So I think peers are really helpful in that regard. And then as far as family members, family support or friend support or spousal support is such a good indicator, for veterans who are going to do well, right? So it's a really important factor in people's lives. And family members need peers too, right? So I wanted to mention NAMI has a program, I think nationally and locally, a family-to-family program where they'll do support groups and really, as peers of like a spouse or a mother of someone who may be struggling with mental health to another spouse or mother of someone struggling with mental health who maybe is a few years down the road, you may get some kind of peer mentoring of how do I talk with my loved one? How far do I push? Those sorts of things. The VA has like a nice program too that I really like called Coaching into Care. It's just a phone number that you can call to get some information and guidance when we wonder those things like, what do I say to this family member? How far do I push? Things like that.
Excellent. And I want to mention, it's so funny. It just hit me. There's another resource, and I know, Dr. Welch, you know about this one. I think, Chris, you may know about it too, but Higher Ground.
Yeah.
Higher Ground is another phenomenal program. It's an outdoor adaptive therapy program. And I was privileged to be behavioral health support twice locally. It was at Beaver Hollow. And I had the privilege of being with these veterans who either had TBI or some other type of, would be MST and really, or PTSD. And it was really learning a lot about their experience firsthand. and it gave me a really phenomenal perspective on what, many times our veterans have to endure, in these situations, in combat or even, afterwards. And it was just so enlightening for me. And like I said, I really felt privileged to be there because it's like being on the inside. I mean, for those who are watching who have never been in the military, we watch these television reports and TV news, and you hear about reporters being embedded, with military, like they're traveling, whatever, they're with them. So I felt like I was embedded in a way with these veterans, and I got a chance to hear their stories, and it really gave me a really profound sense of empathy for what their experience was like, and how challenging it is to transition back into civilian lifestyle. And these are men and women who have served honorably. And so Higher Ground is another phenomenal program that I just wanted to make mention of. I
was just actually also thinking, just to touch on the peer and the mentoring piece of it, as Katie was talking. ComPeer is another organization locally that is a mentoring agency where they, pair people with, a peer mentor, and they actually have a veterans piece of that as well. And I think it's a little, less known. So I just wanted to mention that as well, because it's a great program. They match, their mentors with the individual who's looking for it on a case-by-case basis to really find a good fit. Because it's a veterans-based program, they really do look for, volunteer veteran mentors, again, along the lines of, that peer support, someone that you can, who's been going through it, you can ask questions of, assist you maybe with making some of those, decisions. And again, kind of non-clinical, more of, the mentoring piece of it. So that's another, great resource, as well as ComPeer's mentoring program.
Yeah, the ComPeer program is called ComPeer Core.
Yeah.
If I'm not wrong, yes.
Yeah.
And I know it well. So thank you for the reminder. So sure. Really, I'm loving this conversation because we'll really find out a lot about what's out there. And for instance, I did work at the Mental Health Advocates, and I know sometimes, like I said in the beginning, folks just need to know where to go. And so we have some great experts here with us today who are sharing this information. So if you're watching right now, please make note of this information. At the end, we're going to be sharing some other resources. If you go to the Facebook page that you find this event on, there'll be resources. So we just want you to know that help is available, and that's the key. We want to let everyone know. Sometimes you get frustrated thinking that perhaps no one cares, or we just can't get there with what we need, but it is possible. So maybe another thing I just want to mention, to go back to maybe what, if you want to say, Dr. Welch, anything you want to add? I'm sorry, Chris, if you want to add anything to what you will say about the peer?
Just to piggyback off what Katie and Patrick had made mention before about, drawing the individuals out who are basically secluding themselves. One of the things that we have actually done several times before in the past, and we just had happen this morning, is we'll have that spouse, family member, or friend literally talk that individual, that veteran, into, let's just get out and go grab a coffee. And I nonchalantly walk in with the dog, and they're, oh, Chris, hey, it's nice to see you here. And it starts the conversation, because immediately now that veteran individual has drawn their attention to not what's going on around him or her, but wait a minute, there's a dog in here. If there's anything that has been learned through the Positive for Heroes program, is that everyone loves dogs. The first reaction everybody gets when they see a dog is, the surprised, happy look. So we use the dog a lot to also draw the veteran, him or her, out, and hey, you can have this too, but we got to get you to this point where you're willing to get out of the house, and you're going to have to walk the dog, and it's going to cause you to socialize and interact in the community, because people are going to have questions, and you got to be able to answer them. You got to walk the dog and go to the store and get dog food, so on and so forth. And kind of, working in about the spouse or family member who's also dealing with the veteran. One of the things that we're starting with our peer-to-peer program, Operation Boots, and is we decided to have date night. So to bring the veteran and their spouse together, a lot of the times it's just because there's so much going on in the veterans world and so much going on at home with the family that the veteran and the spouse really don't have time together alone. So we're bringing them together to have a date night on Western New York Heroes as part of our peer-to-peer program to get them out, let them try to rebuild and ignite their relationship again.
Excellent, excellent. So we have a little bit less than 5 minutes left. So I do want to give each of you an opportunity to make some real brief final comments, takeaways for our audience. So let's start with Dr. Welch. Any last comments?
Yes, I think what I'd like to say to anyone who is watching this program, first of all, if you're a Vietnam veteran, welcome home. I'm glad you made it back, and I hope you're doing well. I think some of the things that we have to do, and Chris mentioned a good one that they're doing with their program. One of the other groups that I recommend a lot of people to is Team RWB, Team Red, White, and Blue. We have a local chapter, and that organization is one of the newer veterans groups, and they're geared toward family. Most of the activities that they get involved in revolve around the family. And as everybody has mentioned in their comments, family support is a critical aspect of veterans deciding to seek help. I know often when I was with the county, I would talk to spouses, who the spouses were the ones who brought the veteran in to seek some help. So I think that's another avenue that we need to look at as a resource to help it. But I think people have to understand that just because you have a mental health issue, it does not mean you're crazy. It does not mean you're weak. It means you have recognized a weakness that you have, and there is help out there for you to become a normal, functioning, well-adjusted, and good quality of life for yourselves.
Thank you. Katie, how about you?
Sure. I think just in closing, a lot of the stigma, I think, can come from this picture we have, right, of a strong, military man or woman. And there's so much truth in that. But I think culturally, sometimes we view the word strong as someone who doesn't need anything, who doesn't need to ask anyone for help. And I think really strength means that you have a wisdom, right, to know what you need when you need it, and the courage to kind of follow down that path. So just wanted anyone that's listening to know that that there is hope and there is help available. And, just as a community, let's be people that support our veterans and support our military members and families in whatever way we can.
Thank you so much, Katie. Chris.
Yeah, again, to piggyback off what Katie and Patrick had mentioned, we hear it all the time too, that, I don't need the help, I'm not weak. Well, it actually takes someone even stronger to ask for that help. And that's, all the services that are available to veterans from the VA all the way down. It takes a stronger person to ask for that help, and you're not alone. There's so many individuals out there that are just like you, and everyone needs the help. And going back to what Patrick touched on, going to war and coming back home, I don't care how big and bad you think you are, it's going to affect you in some shape, way, or form, mentally, physically, or otherwise. Everyone's going to need that help. And you're only fooling yourself if you don't ask for the help.
Thank you, Chris. And last, but certainly not least, Kathleen.
I agree with what everybody has said in regards to, the stigma and individuals needing to be strong and being able to take care of, things on their own. But, agree with everybody in the sense of, being able to reach out and seek out help when you need it shows, definitely a different kind of strength. But also just, knowing how important family support, community support is, that we need to look at all of that, not just, the stigma, as an individual, but talk about it, have that conversation, with your friends, your family member, have the conversation, with your kids. If it's an open conversation in your family, an open conversation in the community, it'll encourage more people to be able to talk about it and reach out for help. So I think, families and community definitely are important and tied right into all of it.
Excellent. Thank you so much. So as a reminder to our audience, we need you to take the pledge and stigma. Just visit our website at letstalkstigma.org, and by entering your email address, we ask you to avoid using stigmatizing terms, speak out against mental illness, stigma, and discrimination, spread awareness about mental health, and continue learning about mental health to replace myths and fears with truth and understanding. Also, if your company would like to join us as an organization member, you just click on the membership tab on our homepage to learn more. Together, we can make this happen. So once again, I'd like to thank our panelists, Chris Kreiger from WNYHeroes, Katie Coric, Suicide Prevention Coordinator and Emergency Services Program Manager for the VA West New York Healthcare System, Dr. Patrick Welch, Veterans Advocate and Senior Mentor with the Buffalo Veterans Treatment Board and Board Chair for the Community Veterans Engagement Board, and lastly, Kathleen Larsen, Contract Coordinator with the Erie County Department of Mental Health. I'd also like to thank the folks behind the scenes, Telesco Creative Group, for their hard work on getting us up and running, and Carol Doggett from the Mental Health Advocates of West New York for her help in preparing this program today. So on behalf of the Erie County Anti-Stigma Coalition, until next time, I'm your host, Kyle Shallahorn. Be well.
Thank you.